About 140,000 Georgians have Alzheimer's disease. That number is projected to increase to 190,000 by 2025. A recent survey showed that 385,000 Georgians report some form of cognitive impairment, but 80% of them have never received an evaluation or diagnosis. In fact, there's an average 6-year delay in getting a diagnosis related to memory loss or other cognitive function loss in Georgia. And undiagnosed Alzheimer's cases lead to $2 billion worth of preventable emergency room visits, hospital admissions, and skilled nursing facility placements in Georgia each year. It's a big problem. That's why Georgia MemoryNet is here. Georgia MemoryNet provides faster diagnoses for Alzheimer's and related dementias for Georgians showing signs of memory loss or cognitive decline. Georgia MemoryNet also connects diagnosed patients with support services in their local area. Primary care providers and neurologists can refer patients in need of diagnosis for Alzheimer's or related dementias to one of our clinics located around the state. Georgia MemoryNet can also provide diagnoses through telemedicine using a smartphone or computer. The Georgia MemoryNet process often begins when a patient or family member has concerns about memory loss or cognitive decline and addresses those concerns with the patient's primary care provider. If the primary care provider detects signs of memory loss or cognitive decline through a patient's annual wellness visit or other observations, they can refer the patient to a Georgia MemoryNet memory assessment clinic for evaluation. The patient's first memory assessment clinic visit, whether in person or via telemedicine, is to discuss the issues, do diagnostic testing, and determine if any other studies or assessments are needed. During the second visit, the patient and their care partners review the data and discuss the diagnosis with Georgia MemoryNet specialists. The patient and their care partners will also meet with a community services educator for personalized patient and family-centered goal setting and care planning based on diagnosis. The community services educator will also connect the patient and care partners with resources and community support in their local area. The patient, their care partners, and the patient's primary care provider receive a personalized care plan for ongoing care. Georgia MemoryNet diagnoses patients and develops care plans to empower primary care providers so they can provide ongoing care after the memory assessment clinic's visits. For some Georgians, visiting a memory assessment clinic might be a challenge due to mobility issues, distance, health concerns, or other reasons. That's why Georgia MemoryNet provides assisted telemedicine options for patients in every corner of Georgia. Telemedicine uses devices like smartphones, tablets, or computers to connect instead of meeting in person. For those who need diagnosis but can't visit a clinic, Georgia MemoryNet has an assisted telemedicine option to make it accessible and easy. Is a referral to Georgia MemoryNet right for you, your loved one, or your patient? Georgians showing signs of memory loss are likely to benefit from our services. They might also have mild cognitive complaints, which could include having a hard time with language, getting lost, or finding it difficult to manage finances, medications, chores, or work. They or their family may be concerned about their behaviors too. On the other hand, Georgians who are already diagnosed, under 50, or who have a history of traumatic brain injury might not benefit from Georgia MemoryNet services. Patients already living in a skilled nursing or memory care facility also might not benefit from a referral. There are lots of programs that support Georgians with Alzheimer's and related dementias and their care partners with a variety of services. Part of Georgia MemoryNet's services is to help Georgians with symptoms, but without clear diagnoses, connect with these community-based resources. These are just a few of the community partners who make up our network. Clearly, Alzheimer's disease is a big challenge in Georgia, and it's getting bigger. But we can do a better job diagnosing, treating, and supporting Georgians with undiagnosed dementias. Georgia MemoryNet is hopeful that more effective therapies are right around the corner. But until then, we will continue to focus on improving care and quality available now. Visit us anytime at gamemorynet.org.